सदाशिवसमारम्भां शङ्कराचार्यमध्यमाम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम्. ॐ गङ्गणपतये नमः. ॐ श्रीराधाकृष्णाय नमः. ॐ श्रीदक्षिणामूर्तये नमः. Volume.
Someone's white car is on in the parking lot. It's running.
Someone's white car is on in the parking lot running. Nobody's inside the car, is it?
Nobody's inside the car.
If it's your car, please go and save some planet. Okay. Sorry, excuse me, I forgot my cushion, back cushion. That chair is really good for Swamiji because he can just sit up there very easily with his legs crossed, which I cannot do. Om Sahana Vavatu Sahanau Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu ma vidvishavahai. Om Shanti Shanti Shanti. So welcome back, everyone. Welcome also to those watching the classes online. Is the audio okay at the back? We're trying different microphones. Good? You want it higher? Okay. We're trying different microphones, so it's just a learning, it's just a process it's going to take to figure out which microphone suits my voice. Okay, so last class, actually before we come to last class, there are many goals for meditation, and there are many techniques you can do to achieve that particular goal. For many people, one of the goals of meditation is to relieve stress, to feel more relaxed, to feel more at peace, to be calm. Last week we saw that how, for those of you who didn't attend the class, the video is online on Swamiji's channel. We saw how stress, mental, emotional stress, can affect the body, can exhibit as symptoms in the body, as physical symptoms. And we practiced a body scan meditation. That's the term they use in mindfulness meditation circles. Basically, it's like you're scanning, you're scanning the body as though you're going through one of those scanning machines, and to just see which part of the body is holding tension, and you kind of learn to relax, release that tension. Besides meditation, there are many other techniques to relieve stress, to feel relaxed. Of course, breathing exercises very often, especially the pranayama, diaphragmatic breathing, can help to bring the mind under control, to bring the stress level down. Visualization techniques in meditation, even open-eyed visualization. So you can imagine yourself in a very, in a place that you feel very, you have felt very, I have to back up and say, is there any time in your life that you have never ever felt peace and calm and relaxed? Never ever. So just look back. I'm sure if you search deep enough, you'll find perhaps a moment just this past week that things were okay, that you were feeling at ease, you were feeling relaxed. But these visualization techniques, you can put yourself in a place which you connect, which you have a memory of, where you have felt very calm and peaceful. It can be a place in nature, it can be a temple, whatever place you find, you have felt that peace and calm. So besides these, there are many other techniques to help relax the body, to help relieve the stress and tension that we feel. One technique that is very commonly used, and especially by therapists, is a technique called progressive muscle relaxation, abbreviated as PMR. It's a very deep relaxation technique which is used to decrease generalized anxiety, to induce sleep. Of course, if today your goal is to induce sleep, it might really work well for you, because that's what we're going to practice. But many people struggle with insomnia, getting up in the middle of the night, not able to go back to bed. And what do most people do who wake up in the middle of the night? Cell phone. Actually, if you look at the American Sleep Association website, where they give you good sleep hygiene habits, one of the main things you should not do is turn on any blue screen, blue light. Not to turn on the computer, of course, nowadays I think most people don't use the computers, everything is on the cell. Not to turn on the TV. Any of these blue light or these stimulate parts of the brain that prevent the sleep cycle from starting. So this progressive muscle relaxation, we'll practice that technique today. I was surprised when I went and looked on PubMed, which is the site for a lot of the scientific articles, scientific journals. There are more than 5,000 papers that were published just within the past year on specifically this PMR, progressive muscle relaxation. So I went back, you have criteria to search, filters you can do this search with various filters. And when I didn't put the year, for just limiting it to 1 year, maybe in about the past 10 years, there are 50,000 plus papers. So this is really, I guess the reason I'm pointing it out is it's important enough that the scientific community is taking note of it. There's so much publications on this technique. So how does this progressive muscle relaxation work? It reduces anxiety by lowering the 4 Fs we saw in the last class, the 4F response to stress: fight, flight, freeze, or fawn. And the 5th one was flop. But when you flop and you faint, you really can't do anything. So that's just the body response to a stressful stimuli. It helps to improve sleep and does that by quieting. It helps to quiet a racing mind. Many times you don't get sleep or your sleep is disturbed because of things going on in the mind. Of course, if your sleep is disturbed because of your partner who's snoring, that's a completely different reason. But if your sleep is disturbed because of your own mind, you have a bunch of to-do things on your list, you have a important event coming up, your mind is just going non-stop. It helps to practicing this technique when you wake up in the middle of the night helps to kind of slow that mind that seems to be going on its own, and it can induce you into a more into the sleep rhythm. It also helps to manage pain. Science is showing that it helps to remove tension headaches, migraines, any chronic back pain, neck pain. Because the reason, and I'll come to that reason in a little bit, and also reduces other symptoms of stress that we may not even think about, is GI symptoms in the gastrointestinal tract. Sometimes people who have, many times, there is one, if I am correct, I've read this long back, people who suffer from irritable bowel syndrome, IBS. It is a trigger. Of course, there are many factors that cause people to have IBS, but the mental stimulation of the stress. Remember, your gut, your intestines, your stomach are all innervated with nerves. So anything that affects the brain is bound to affect other parts of your body as well. So what exactly is this progressive muscle relaxation? So the technique consists of tensing or tightening one muscle at a time throughout the body. You tense it, and then you release the tension. And when you're releasing the tension, you have a deep exhale, your diaphragmatic breathing. That deep inhalation and exhalation as you tense the muscle and release the tightness helps to release the stress, makes the muscle relax. Typical muscles where we hold stress is our eyes, our face, our mouth, jaws, neck and shoulder, especially if you're doing this the whole day, crunched. Of course, this is the mudra for Swamiji's joke usually. This is the mudra for sitting on the computer. But I think now we have a new mudra using the phone. I don't know how people hold the phone when they're working, but one of you can demonstrate who does it all the time. In the stomach, in the chest, wherever we hold the stress, this progressive muscle, it's called progressive because it's doing one muscle group at a time. And it's tightening, releasing, tightening, releasing. So what does this do for us? It really, what this technique teaches us is to first of all feel what a tight muscle feels like for us. For each of us, it's different, right? What sensations you feel when a muscle tightens is different because it depends on your body. But you learn what it feels when a muscle is tight, and then you learn to recognize what it feels when the muscle is relaxed. So with that, it helps you, as you build on this practice, at a time when you're feeling mental stress, emotional stress, you can dip into this practice because you may not even know that mental stress is causing a physical stress in your body. And you can learn to recognize which part of the body, which muscle is tensed, and practice this technique at that time to release the tension there. So how is this progressive muscle relaxation done? Like I said, we'll scan through, we'll progressively go through each muscle group in the body. And some practitioners do it starting from the head going down to the feet. Others do it the other way around. If you're feeling a tension outside of a meditation class, or when you're doing the practice, if you're sitting in the car for a long time, if you're driving, going on a long trip and you're driving for a long time, perhaps you feel stress and tension. Firstly, the tension of the traffic zigging in and out. But you could also just feel, because your body is sitting in a posture for an extended period of time, maybe tension in the neck and shoulders. And you can use this technique just to relieve tension in that part of your body. Many times teachers would suggest you to do this practice lying down. But you can do it in any posture that you like. The lying down is mentioned, especially if you're using this technique to get better sleep, if your sleep is disturbed. I think if your sleep is disturbed and then you sit up straight to do this practice, sit up in a chair, not sure how effective it will be, you might want to try it to see what works. There are some important caveats or notes to mention about this practice. Firstly, it's important to breathe properly. Never to breathe, take an inhale or an exhale, inhale so deeply that it's very uncomfortable for you, that you're kind of bursting, you're not getting that breath of air. Don't hold your breath so much that you start feeling uncomfortable or think you're going to pass out. The technique is generally safe, but if you suffer from, say, muscle cramps or any other muscle spasms or any severe musculoskeletal problems, then perhaps, or even chronic pain, if it's an acute pain caused because of stress, it's fine. But if it's a chronic pain in a particular area, you might want to go a little easy on how tense, how tight you make that muscle. And if you have areas in the body that are currently you're experiencing pain as we do this practice, you can just skip that body part, or you can do a very, you can skip the body part. Instead of tightening it, you can just do a deep inhalation and exhalation as you breathe into that body part. So the summary, of what this practice is, what is the purpose of the practice of this progressive muscle relaxation, is to release the stress that we are feeling in various muscles in parts of our body. And as we practice, as we begin our practice, you take a sankalpa, a statement of intent. So as we're doing this practice, is your mind going to wander? It's a given. It's a given that your mind will wander. It might wander less, it might wander more, depending on you, depending on what all is going on in your mind right now or today. So if your mind wanders, as you hear I will be guiding you through it, as you hear the guidance, if your mind wanders and you see, oh my gosh, the mind has wandered, you just bring it back to whatever body part we are at that moment and get back into your breathing to exhale. So that's the gist of this practice. I have never taught this before, so I like it very much, but I've never taught it, so I don't know how it will work for you. But this is what mindfulness is about, is we take aspects of our life, day-to-day life, and see how we can make it a meditative practice to become aware of. Just ask before we start, is anybody feeling any tightness anywhere right now in your body? No? Yes? Yes? Back, neck, shoulders. Legs, knees, arthritis patients, knee replacements. So everybody, I shouldn't say everybody, some of you might be feeling some kind of tightness in your body, and maybe that will be an important area for you to focus on. So let's get ready for meditation. And reminder to turn your cell phones off so that it's not a distraction for you and for others. Thank you. Okay, so we sit up in our chair, before we start, if anybody would like to try this lying down, you're welcome to go to the back of the hall and try it. It's a clean, honestly, it's a clean place, so it might give you a very different flavor. Anybody want to venture? Don't be shy. You're at the back of the hall. Nobody's looking at you. So, okay. So let's sit in a comfortable posture. Adjust your posture so that you feel comfortable. The posture should be erect, but not tense. So you might want to tuck your tailbones into the chair, lower back into the chair so that you're not, so that your body, so that your head, neck, the trunk of your body is perpendicular to your lower half of the body. That way you're not bound to lean way back or lean way in front. And keeping your head looking straight, not up nor down. And just breathing at a normal pace. Feeling the air from the room come into your body as you inhale. And leave your body through your nostrils as you exhale. And taking a little deeper inhale right now. And as you exhale, make it slow, slow, releasing any tension you might be feeling in any part of the body. So a little deeper inhale. And a slow exhale. As you feel your body relax, sink into the chair almost. One more deep inhale and a slow exhale, letting go, letting go. Letting go of any tension you might be holding in your body. So for today's practice, we'll start from our top of our head, from our face, and move downwards. For this progressive muscle relaxation, we'll take different muscle groups, different body parts, deliberately tensing them and then releasing them. So let's begin with our face. Many times we hold tension in our forehead. Our forehead might have wrinkles because of stress. So right now, with your eyes closed, just gently lift your eyebrows up. Lifting your eyebrows up with your eyes closed towards the top of your head, holding for 5 seconds. Hold, 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 and bringing it back down. Exhaling. Taking a deep in-breath and exhaling out any stress. Relaxing your forehead, relaxing your eyebrows. We also carry tension in our eyes and the muscles surrounding our eyes that hold our eyes. So we learn how to recognize what that feels like first by tensing, closing your eyes tightly. Hold for 5. And then on the exhale, release the eyes, release the tightness, bringing your eyes back to feel relaxed. Taking a deep breath in, and as you exhale out, see if you can release the tension in the muscles of the eyes and forehead even further. Breathing out the tension, as it were, from the eyes, forehead. Then we move to the muscles around of our face, around the nose, the mouth, the jaws. So wriggle your jaws a few times, especially move your lower jaw left to right. Open your mouth wide. See where you hold the tension in your jaw. And then hold your mouth in a deliberate smile, wide, clenching your teeth as much as you can. Hold for 5. Notice where you feel the tension in your mouth, inside the mouth, the muscles of the face, and then relax. Let go. Exhale out. Take a deep in-breath, and at the exhale, release all the tension in the muscles around the mouth, the nose, the face. Take one more deep inhale and let go of all the tension in the forehead, eyes, around the eyes, the nose, the jaws, as you exhale out, and we leave this part of the body as we progress further. Taking a deep in-breath, and see if you can relax these muscles further as you exhale. Then we come to the shoulders and the neck, back of the neck, where many times we hold tension. To begin with, you can just roll your shoulder up and down, starting front to back one time, and then back to front one time. Notice if there's any pain, and if you have particular pain in this area, just be gentle in how tight or how you roll your neck, your shoulder. For the muscles of the neck, if you don't have any dizziness or health problems, tilt your head to your left shoulder. Bring it back center, tilt to the right, bring your head back center, tilt your head down, your chin almost touching your chest. Feel the tension in the back of the neck, muscles of the neck, and then move your head. Tilt your head back. Feel the muscles of the neck strain and pull, and bring back your head to the center. Take a deep inhale and exhale out slowly. Next, lift your shoulders up as though they were touching your earlobes, the bottom of your earlobes. Notice which part of your shoulders, what your shoulders feel. Hold for 5. Release, exhale, bring your shoulders down, back. Take a deep inhale and exhale out slowly, releasing the tension in your shoulders. Now coming forward a little bit in your chair as you're seated, move your shoulders backwards as though your shoulder blades are touching each other at the back. Hold. Release and exhale. Bring your shoulders back to their normal position. Take a deep inhale and exhale out the tension. Slow exhale as you release the tightness in your shoulders and neck. Now we'll move to our arms and hands. So bring your hands close to your body. Let the sides of your body touch your upper arms, and then raise your arms bending at the elbow. Just bring your arms in front of you with your elbows bent. Keep your arms parallel to the floor, and then make a fist with your hands. Make a fist with your hands. Notice the tightness that you feel in the entire arm. Not only the hands, but the wrist, the forearms, the upper arms. Let go, open your fist. Bring your hands back down as you exhale. Take a deep breath in and exhale out all the tightness further in your upper arms, elbows, lower arms, forearms, wrist, and hands, all the way up to your fingertips. You can stretch your fingers, spread them out, and notice the tightness in each finger. Hold. Release. Exhale. Bring your fingers back, your hands resting on your palm, on your laps. Take a deep inhale and a slow exhale as you release all the tension, tightness in the muscles in your hands and your fingers. Next, we move to the big muscles in our back and our chest, the big muscle groups. For this, we just take a deep inhale, a little deeper. Notice how your ribs, the muscles around you holding your ribs, expand as you inhale. Hold, release, exhale. If you move a little front in your chair away from leaning to the back of your chair, you can feel this body part a little better. So we take a deep inhale, hold, and release as you exhale. Notice how the muscles of the lower and middle back also tighten and relax. Let's do it one more time. A deep inhale, hold, and exhale. Now our abdomen. For this again, you can take a deep inhale, and as you exhale, take a deeper exhale so much that you feel your entire abdomen move towards your spinal cord. Hold it there, and then take a deep inhale again. So inhale deeply, exhale slowly, exhale, exhale, exhale. Feel your abdomen moving towards your spinal cord, towards your back, and release. Come back to your normal breathing. Next, we move on to our hips, our thighs, our entire legs, and our feet. So for those of you who are sitting on the regular chairs, you can move a little in front away from leaning towards the back of the chair. Even for those of you're sitting on the floor chairs, and press your foot down on the floor as tightly as you can. It might be a little harder for those of you who are sitting on the back jacks, on the floor chairs, because it's the side of your feet that's pressing against the floor. So press it tightly and notice the muscles of the feet, the calves, the thighs, the buttocks, the entire pelvic region tightening up. Hold and release. Exhale, release. Do this one more time, pressing your feet firmly against the floor, tightening the entire leg and the back, lower back, the pelvis. Hold and release. Exhale out, release. Take a deep breath in. Slow exhale, release all the tightness in your entire legs, your hips, pelvis, lower back. And now we'll come to our feet in particular, because our feet carry the whole weight of our body, and sometimes we don't pay attention to the feet. So first start by curling your toes inwards. Curling your toes inwards. Notice the tightness you feel in your little muscles of the toes, and the arch and the sole. And let go, release. wiggle your toes and notice, see if you can see the difference when you wiggle your toes, the different tension in each individual toe. Wiggle it and then stretch your toes out as you did with your fingers. Spread your toes, hold and release. And for those who are sitting on the regular chairs, keeping your, I'm not sure how easy it would be for those of you sitting on the floor chairs, but keeping your heels flat on the floor, raise your feet upwards towards your body, and notice how your calf muscles tense up, how the knees and the thighs tense up. Hold, release. Take a deep inhale and exhale slowly, releasing all the tightness in our calves, in our feet. And now just adjust your posture if you need to, because sometimes after tensing different muscle groups, you might feel a little tightness in a particular area. And we take a deep inhale, and as we exhale, release the tension, the tightness in any part of the body that is still holding on, any muscle that is still holding on to the tightness. Perhaps it could be your calf or feet, because that was the last body part we just did. Take a deep inhale, and as you scan through your body, exhale slowly, releasing any tightness in any part of your body that hasn't yet been released. One more deep inhale and a very slow, deliberate exhale to relax your body further so that it's almost limp. Letting go. One deep inhale, exhale, letting go, letting go. Letting go of the tightness, of the tension, of the stress. Coming back to a normal breathing pattern. And as we come to the end of this meditation, just take a moment to see how your body feels. For those who began with some tightness or pain, notice how that body part feels right now. And as we settle into our normal breathing, you can gently open your eyes and stretch out if you need to as we come to the end of this meditation. Surika, slide. No. Keep it at a mark. There's a marker on there, right? Thank you. Anybody slept off? No, I mean the meditation is used for sleep also, right? No harm if you slept off, just curious to know if the sleep aspect worked for you or the relaxation aspect worked for you. We have a few minutes. Any thoughts, questions, comments? Or you're in a completely relaxed zone? Yes, Geeta. You can do it a few times. Today this was for, in the interest of time, I was just doing it once so that we cover the entire body. You can do it as many times as you want, especially if you're just focusing on one area which is tight. That is the idea, you do it many times so that the muscles relax. Yeah. Yes? For the head. So because it's a bony area, right, the skull, not much up there, no muscles there. So there are techniques which I have never taught where you can deliberately use your hands to stretch different areas. Kind of massage, get a head massage if that helps. Many times, I feel when I have my glasses on, my eyes and my ears feel the stress because of the weight of the glasses. So you can obviously do the meditation without glasses, or if you're wearing very big earrings, that could also be distracting. Any other questions, thoughts? Just out of curiosity, did your mind, I felt my mind was not wandering at all. I don't know how you all felt because it's so engaging, So this is did any of you feel that your mind was wandering lots or less? Lots? Less. So, of course, if your mind wanders lots, it's fine. There's no judgment here. It is what it is for you today. So that's another advantage of doing a technique like this, even if it's not for sleep when your mind is racing, but if you sit to, actually all these, the last week's and today's practice is really preparatory steps for meditation. We call it meditation, and mindfulness circles, they don't go beyond, they don't do Vedantic meditation. So all these breathing exercises, this progressive muscle relaxation, body scan is really preparation for a more meditative practice. So you can use this practice every day that you sit to meditate, which I'm sure everybody is doing. Do it for 5 or 10 minutes before you get into whatever technique, mantra technique or something that you're doing. And you'll find your mind will wander less because it's already prepared, so to say, to wander less. Okay? Yes?
I found smiling when you're exhaling extra relaxing.
Smiling, exhaling, extra relaxing?
Smiling, yeah. Smiling. Creating a smile on your face, that was extra relaxing.
But did you feel the tightness of the muscles?
Yes.
Yeah. So you felt, I know you're trying to probably say that smiling is good for you. Yeah. There is actually, I think when I read it somewhere, when you smile, it uses how many muscles there's a big number, like any
400 something.
400? That?
Yeah.
Do we have so many muscles in the face?
That's what they say, like the baby smiles like these many times a day, and as we grow older, we don't smile, and that increases the tension and stress on our body.
So she's saying when I don't know if, to me 400 seems a large number, but I remember like 20 or something like that, and she's commenting when a baby smiles, what happens when you see a baby smile? What do you do? you automatically smile. So keep babies in your house. If you don't have a baby, keep a toy that, a doll that keeps smiling so that you can practice to let go. And yes, smiling is a way to let go. 17, so he looked it up on Google, and 17, I don't know how accurate that is. Okay, it is time for next class, so we'll end with our prayer. Om sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet, asato ma sadgamaya, tamaso ma jyotirgamaya, mrityorma amritangamaya. Om Shanti 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 Harihi Om Shri Gurubhyo Namaha Harihi Om.